What do you think of when you hear the words world-class healthcare? Do you picture Nobel Prizes, gene editing breakthroughs that feel straight out of a sci-fi movie? Maybe a team of elite surgeons performing a miraculous 18-hour operation you saw on Grey's Anatomy. Here in the United States, we're proud of that image. We spend more on healthcare than any other nation on Earth, a staggering $4.5 trillion in 2022 alone. That's $13,493 for every single person. We have the brightest minds, the most advanced MRI machines, the Da Vinci surgical robots. But let's be honest for a second. Let's step away from the Hollywood drama and think about real life. When was the last time you needed a gene editing specialist? For most of us, our healthcare needs are profoundly normal. A kid with a broken arm from falling off his bike, that wisdom tooth that's been throbbing for a week, a sudden weird rash you just want a professional to look at, or that nagging feeling that something's not right and you just want to get a checkup, a real thorough checkup without it costing a fortune. For that kind of healthcare, the 99% of medicine that you and I actually use, what if I told you the American system isn't just being beaten, it's being lapped? And what if I told you it's being lapped by a small, developing, socialist country on the other side of the planet, a country that America was at war with just 50 years ago? Today on New to US, we're going to challenge everything you thought you knew about healthcare. I'm going to prove to you that for the things that matter most, speed, cost, and accessibility, the system in Vietnam isn't just good, it's shockingly, almost impossibly better than what we have in the United States. And the reason why will absolutely blow your mind. You're going to be surprised. You might even get a little angry, so stick with me until the end. Part 1. The race against time. Side-by-side comparison. Let's start with the single most critical element in healthcare: speed. In medicine, speed isn't a luxury. It's the difference between a minor issue and a major crisis. It's the difference between reassurance and weeks of anxiety. It's a fire department that shows up in 5 minutes versus 5 weeks. So let's play out a scenario. Imagine you wake up with a sharp, persistent pain in your abdomen. You're worried. You need to see a specialist, a gastroenterologist. In the United States, your journey begins. First, you need an appointment with your primary care physician, your PCP. A 2022 survey by Merritt Hawkins found the average wait time just to see a family doctor is 20 days. Okay, so 3 weeks later, you finally see your PCP, they agree you need a specialist, they give you a referral. Now, you call the specialist's office. The same survey found the average wait time to see a new gastroenterologist in a major US city is 35 days. Let's add that up. You could be waiting almost 2 months from the day you felt that pain to the day you finally see the right doctor. 2 months of worry, of pain, of your condition potentially getting worse. We've all been there. It's a system of wait and see. Now, let's rewind. You wake up with that same sharp pain, but this time you're in Ho Chi Minh City, Vietnam. In Vietnam, your journey is different. You don't call anyone, you just go. You can walk into a major public or private hospital, go to the registration desk and say, "I have stomach pain, I want to see a gastroenterologist." You pay a registration fee, which is often less than a Starbucks coffee, about $3 to $5. You get a number, and you wait. How long? Maybe an hour, maybe 2 if it's a really busy day. Not 2 months, 2 hours. Within the same morning, you will be sitting in front of a specialist. That doctor won't just talk to you, they will act. Okay, let's get an ultrasound right now. Let's do a blood test right now. You walk down the hall to the imaging department, get your scan, go to the lab, get your blood drawn. You'll have the results in your hand in another hour or 2. By lunchtime of the same day, you're back in the specialist's office, he's looking at your test results, your ultrasound images, and giving you a diagnosis. If it's serious, you're admitted to the hospital on the spot. If it's not, you walk out with a prescription and peace of mind. This isn't an exaggeration. This is the standard. Curing people is a race against time. And on the metric of speed, of getting you from worried to treated, it's not even a competition. Vietnam is playing a different sport entirely. Part 2. The bill. Okay, so it's fast, you're probably thinking, but what about the cost? It must be expensive, right? I want you to prepare yourself, because the numbers I'm about to share are so outrageously different, they sound like a lie, but I assure you they are very, very real. Let's talk about something simple: dental care. A standard, non-surgical root canal in the United States, after insurance, can still easily cost you $1,500 to $2,500. Many people just can't afford it, so they have the tooth pulled, or worse, do nothing. In Vietnam, at a modern, clean, high-tech dental clinic in Hanoi or Da Nang, that same root canal, using the same materials and technology, you'll pay between $50 and $150 total, no insurance needed, because the price is already lower than most American copays. Let's make it more serious: an ER visit. According to United Health Group, the average cost for a basic ER visit in the United States is around $1,300. If it's complex, it can easily top $3,000. In Vietnam, a visit to the emergency room at a top private international hospital might cost you $100 to $150, including immediate tests and scans. At a public hospital, it's a fraction of that. Let's get really serious: having a baby. The Kaiser Family Foundation reports the average cost of childbirth in the U.S. is $18,865. With insurance, the average out-of-pocket is still over $2,800. In Vietnam, a childbirth package at a top-tier private hospital with a private suite and gourmet meals costs around $2,000 to $4,000, the total package. How is this possible? Are they using bamboo tools? Are the doctors unqualified? This is where we get to the core of the issue, the secret to Vietnam's system. But before I reveal that, let's just sit with this for a moment. In America, we have a term for the #1 cause of personal bankruptcy: medical debt. Over 100 million Americans, that's 41% of the adult population, currently have healthcare debt. The total amount is at least $220 billion. We have created a system where getting sick can financially ruin you for life. In Vietnam, the concept of medical bankruptcy for common procedures is virtually non-existent. The secret isn't magic, it's politics. So why? How can a country with a GDP per capita of around $4,000 achieve what a country with a GDP per capita of $80,000 cannot? The answer, ironically, comes from a word that many Americans makes deeply uncomfortable: communism. Well, sort of. Vietnam is officially the Socialist Republic of Vietnam, ruled by the Communist Party, but it operates a socialist-oriented market economy. What does that mean for healthcare? It means the government believes that basic healthcare is a fundamental right, not a commodity to be traded for maximum profit. Here's how they do it. First, the government builds hospitals, a lot of them. In every province, every major city, even in smaller districts, there are public hospitals funded and managed by the state. These aren't dilapidated relics. Many are massive, modernizing institutions. Because the government runs them, their primary goal isn't profit. Their goal is to serve the population. This creates a price floor. They set a baseline for what medical services should cost, and that baseline is deliberately kept low and affordable for the entire population of 100 million people. And second, they foster competition. Now, this is where it gets interesting. Vietnam isn't a purely state-controlled system. It has a booming private healthcare sector. You have world-class private hospitals like Vinmec, built by Vietnam's richest man, FV Hospital, and others. But here's the genius part. These private hospitals can't just charge whatever they want. They have to compete with the public system. If their prices are too high, people will just go to the public hospital next door. So what do? They compete on service. They offer beautiful, hotel-like private rooms, 5-star customer service, English-speaking staff, and little to no wait times. They offer a premium experience for a premium but still reasonable price. This creates a healthy tension. The public system keeps prices low for everyone, and the private system has to offer incredible value to justify its higher costs. In America, we don't have this balance. Our system is almost entirely for profit, creating a race to the top for prices, with insurance companies, hospital networks, and pharmaceutical giants all fighting for a piece of that $4.5 trillion. And third, there's the culture around doctors. In Vietnam, becoming a doctor is arguably the most respected and sought-after profession. The absolute best and brightest students in the country don't dream of going to Wall Street, they dream of getting into Hanoi Medical University. It's a path of immense prestige and, crucially, job security. With a vast network of public and private hospitals, doctors never worry about finding a job. Now, let's look at the numbers. The U.S. has more doctors per capita, about 3.6 per 1,000, versus Vietnam's 1.2 per 1,000. But this statistic is misleading. Because Vietnamese doctors see an incredibly high volume of patients, they gain immense practical experience in common diseases very, very quickly. They become experts at diagnosing and treating the 99% of illnesses that affect people every day. You are not a set of billing codes to them. You are a patient who needs to be diagnosed and treated, and there are 10 more people waiting outside. The system is built for volume and efficiency. It's a system where doctors are respected, secure, and focused on one thing: practicing medicine. So, what does this all mean for you, watching this in Ohio or California or Florida? It means the game has changed. A growing trend is emerging, one that the healthcare industry in the US doesn't want you to know about: medical tourism. Let's go back to that $2,500 root canal. Here's a new plan. A round-trip flight from LA to Ho Chi Minh City, about $1,000. A full dental makeover, not just one root canal, but maybe a few fillings, a deep cleaning and whitening, let's say $500 total. A 2-week stay in Vietnam, eating incredible food for $2 a meal, staying in nice Airbnbs, and visiting UNESCO World Heritage Sites, maybe another $1,000. Your grand total? $2,500. You can get your teeth fixed, have the vacation of a lifetime, and experience a new culture for the same price as a single dental procedure back home, a procedure you'd have to wait months for. This isn't just for dental work. It's for orthopedic surgery, health checkups, cosmetic procedures. People are flocking to Vietnam, Thailand, and other countries because they're tired of a system that sees them as a profit center, not a patient. So let's bring it all home. Is America's healthcare system bad? No. If you have a 1 in a million rare cancer, you want to be at Memorial Sloan Kettering in New York. We're the kings of the 1% of medicine. But this channel isn't about the 1%. It's about life for the rest of us. And for the 99% of healthcare needs, the checkups, the broken bones, the infections, the dental work, the American system has become a nightmare of wait times and crippling debt. Vietnam, through a unique blend of state control, market competition, and cultural respect for its doctors, has created a system that is faster, cheaper, and profoundly more human-centered for everyday people. It proves that you don't need to spend the most to be effective. It proves there are other ways. It's a different world, a different perspective, one that's new to us. And that's what we're all about here, challenging the idea that the American way is the only way. So I have to ask you, what has your experience been with the US healthcare system? Have you ever faced an impossible bill or an endless wait time? Have you ever considered medical tourism? Let's have a real conversation in the comments below. Your story matters.
And if you want to keep exploring the shocking and fascinating differences between life in the US and the rest of the world, make sure you hit that subscribe button and ring the bell so you never miss an episode. Thanks for watching. See you in the next one.